Welcome everyone. We'll be starting shortly when more people have come into the meeting. So thanks for joining us. Welcome everybody. Welcome to CND's public meeting this evening. Our subject is Nurses Not Nukes, Why the Government Has Its Priorities Wrong. Over the past decade, when we've been fighting back against the austerity policies inflicted on us all, we've raised the demand, NHS not Trident. In fact, I think this has been pretty much our most popular slogan ever. But over the last year, this cause has been more important than ever, touching each one of us during this pandemic. Health workers have been on the front line more than ever, and we've all wanted their incredible hard work and dedication to be rewarded, not just with thank yous, but with the decent fair wage that they deserve. So I know we were all disgusted when the government said they would only give nurses a 1% pay rise. But then it added insult to injury last month when Boris Johnson's integrated review on defence and so on announced an increase of over 40% in the nuclear arsenal. And it wasn't just the nukes, there were massive increases in military spending at all levels. Not surprisingly, and quite rightly, the anger and outcry has been massive. And it's not just here in the UK that military spending has gone up during a massive public health crisis. Figures released this week show that global military spending in 2020 increased by 2.6% to 1,981 billion. I mean, just incredible. So when you see the reports coming from around the world of the COVID deaths, and while we were waiting for the show to start, we were talking about the terrible situation in India, you know that a tiny fraction of this arms spending would resolve so many of the problems. We could have free vaccines and medications all across the world. We could have massive production of ventilators, PPE, and oxygen. It comes down to this question of priorities. So this is an unfolding disaster that could have been much less severe if governments had put the interests of the people and the support and well-being of our health workers at the heart of their priorities. So we've got a great panel this evening. We've got speakers from the front line, and they're going to share their perspectives on what's going on and what needs to be done instead. Each of our speakers will address you for around 7 to 8 minutes. Then afterwards, we'll have questions, discussion, and so on. So please put your questions in the Q&A box or share thoughts and links in the chat. So without further ado, I'm going to turn to our first speaker, Danielle Tiplady. Danielle is a nurse and she's an activist with the Royal College of Nursing. And those of you who were with us on the big Stop Trident demonstration in 2016 may have seen her from the stage in Trafalgar Square. So big welcome to you, Danielle.
Hi, everyone. I think what I'm going to do first is actually put my video on stop because my Wi-Fi has got a historic problem with playing up if I don't do that. So I hope you don't mind. So hello, I'm Danielle. I'm a nurse who currently lives in London. I'd like to firstly pay tribute on International Workers' Memorial Day to my key worker colleagues, including nearly 1,000 health and social care workers who have lost their lives in the pandemic and paid the ultimate price. The last year has been so hard, hasn't it? For so many of us in so many ways, and I hope that you're all okay. As a nurse, it's been particularly difficult. never did I expect that I would be working in a pandemic. I've kind of had to switch off from so much because, for self-preservation. But recently I've started getting quite aggravated, to say the least. This started when, after a year of hell, the government decided to award nurses and other NHS staff a pitiful and pathetic 1% pay rise. In fact, this made me really angry. In all of the years, the world has seen the value of nurses and nursing. It has seen the safety critical work that we do. The simple fact of the matter is nurses keep people safe. Evidence shows this time and time again, and yet 1% is what the government think we are worth. My wages have fallen by 20%, if not more, due to pay restraint, which is what we've had inflicted on us since 2010. It is not right and it's not fair. 1% is apparently all the country can afford. I would accept that if it wasn't for the fact that the government can throw money at topics and projects of their choice, like a £2.6 million on a press room that they're not even going to use, or £200 billion on Trident, or the £10 billion spent on increasing the number of warheads we have in the country. And contrast this with a 10% pay rise for nurses would cost £3.4 billion. And 81% of that would go back into the economy and be recovered by the government. Trident and nuclear will only harm people, and nurses and nursing will only help and heal. I cannot stress to you how much nurses need to feel valued and need a decent pay rise. We are battered and broken after a year none of us could have ever predicted. Our morale was low before. Can you imagine what it's like now? Nursing is in crisis. We have 40,000 nursing vacancies. Now, after the pandemic, a third of nurses want to leave the profession altogether, and over half of all nurses are headed into retirement in the next 10 years. And what is the one thing that's come out on top that would help nurses to feel more valued? In a recent RCN survey, they found that 73% of people said that this would be better pay. The pathetic pay rises that we get are driving people away from the profession. And we've all seen the result of the lack of nurses in the last year. The scenes on TV of nurses for caring for too many patients in intensive care, nurses crying, and now so many in moral distress. Prioritising spending on war instead of valuing nurses will only exacerbate the nursing crisis. And it's not just here. Worldwide, we're short of about 6 million nurses. Imagine the hundreds of billions of pounds that is spent on nuclear and war that could be spent on nurses and nursing to help care for the world and to keep it safe. The world needs nurses, not nukes. Offering nurses a 1% pay rise is a political choice. The government are choosing not to pay us fairly. And I often hear things like, nurses don't go into it for the money. But at the end of the day, we need to live, we need to pay our rent, our bills, we need to buy food. And at the same time, we hear the heroes narrative from the government, along with ministers saying that nursing is a vocation. And each one of these is just done to undermine and undervalue the safety critical work that we do. And it's an attempt to make us feel like we have to keep doing this for low pay because it is our calling and we're angels. It's not right. Enough is enough, and it's time that nurses are paid fairly. I'm an active member of the RCN, the Royal College of Nursing, and we really need your help in our fight for fair pay, in the Fair Pay for Nursing campaign, which has actually got off to a brilliant start. With the government's 1% pay award announcement, the RCN, which is out of character for them, announced a £35 million strike fund, and since I've been working with Jane McAlevey, she's like a world-renowned organiser, to provide training to nurses on organising so that we can get ourselves ballot ready in the next couple of months, because the final pay award will be announced at the end of May and June. So we need your help. So please just have a look at the RCM website. There's so many things that you can do on there. You can sign their petition, you can get free merchandise, everyone loves a badge and a sticker. And they have different actions you can do as well, like becoming an e-campaigner to join our campaign. And also just write to your MPs and tell them like how disgusting it is in this country that we are able to give hundreds of billions of pounds to nuclear, but only 1% to nurses. For me, that works out at about the 1% at £6 a week before tax. Like, that is what they think that I am worth. And also join the People's Assembly demonstration on the 28th of June in the Nurses Not Nukes contingent, and I might be there myself. So that's all from me. Thank you.
Thanks so much, Danielle. And I have to say that that was extremely moving. And I completely echo the comments that are in the chat there from Jackie and from Annie, you know, about how outrageous this is and, you know, what you really deserve as health workers. And the thing that really struck out to me, what you said is, this is just a political choice not to pay nurses more. You know, they can't claim the money's not there. They're putting a lot of money into a lot of things, including nuclear weapons. So it's a choice, and we have to work with you and do everything we can to support your just claim. So everyone, look at the Royal College of Nursing website and see what you can do to help. And to echo Danielle's suggestion to us all, 26th of June, People's Assembly demonstration. We are having a Nurses Not Nukes block on that. So please come along and join us there. So our next speaker is Matt Fawcett. Matt is the coordinator of the global campaign on military spending, and he's going to talk to us about how this isn't just a UK problem, this is a global problem. And Matt also works for Yorkshire CND. So double welcome to you, Matt. Over to you.
Thanks very much, Kate, and thanks to Danielle. I mean, very much hats off. I'm not a healthcare professional, and I have huge respect for all those who've been putting themselves on the line. So I'm going to share my screen. Hopefully this all works. If you could give me a thumbs up, Kate, if that works. Okay, so I've been asked to come and speak a little bit about the SIPRI figures on global military spending, which were released on Monday of this week. So these are said figures, and I think it's important to just give a little bit of historical context to the figures, which, as Kate mentioned, are absolutely shocking this year. A 2.6% increase, and almost $2 trillion that we're spending annually now on weaponry as a human civilization. But it's important to say this doesn't just rise every year. So we saw very significant drops after the Cold War. We also saw less significant drops after the global economic crisis. And many of us thought that that's what we would see again this year. There were calls from the UN, both for a global ceasefire and also for restraint to be shown in military spending while we dealt with this huge pandemic. And obviously the economic fallout, as well as the sort of health and social fallout. So I think this is the figure which sort of sums it up most for me, really. So just to give it a bit of context, because I think when you talk about billions and trillions, it's very hard for those normal people among us to get a handle on what that really means. So 7% of last year's military spending would vaccinate every single person on Earth against COVID-19. And that's not the people's vaccine, which lots of progressive politicians are currently championing, which would be much cheaper. This is a standard commercial double dose vaccine. So, and I think all of us can agree that we would feel much safer and much more secure knowing that that's what was happening out there in the world. So the pandemic caused massive issues in terms of global food supply. So the UN last year warned of...
Matt, maybe
Go on,
you
Kate.
could just, your sound is going a bit funny. Can you turn your own video off? That shouldn't affect. There you go.
I can. Is that any better?
Yeah, that's fine. Yeah.
That's great. Thanks, Kate. So it's the pandemic has also caused really significant disruption of the global food chain. So the UN last year warned that we were facing famine on a biblical scale, and launched an urgent appeal through the World Food Programme. And that's only 5% of that fund has been met so far. So we saw last week lots of aid agencies come together and say, in just 26 hours last year, you spent the amount of money that we need to keep 34 million people from being pushed to the brink of starvation. And it's really important that whenever we see these sorts of figures and we see these sorts of calls, that we call it out and we make this comparison. It's tremendously important. So what about UK spending? So in the UK, our economy suffered about double the average globally in terms of a fall, but we increased our military expenditure more than the sort of international average. But the problem is that is just the tip of the iceberg. So 2021, we're going to see after the integrated review, which obviously came out in March, as Kate has already mentioned, we're going to see an unparalleled increase in military expenditure. So we haven't seen anything like this since the Korean War, so 70 years ago. So a 10% increase in military spending, and the cost to the UK taxpayer will be £24 billion by the end of this Parliament. So it's worth noting that we're all already paying around about £1,500 a year for every British household on defence. And obviously, as Kate has already mentioned, the UK stockpile of weapons of mass destruction, which is an absolute outrage internationally. But I think one thing that when we're talking about global health that's really important is that we've also, as well as seeing this increase, we've seen the slashing of the UK overseas aid budget, and the speed with which this has been carried out has undermined health and humanitarian initiatives around the globe. So we saw reports today, and many will have read in The Guardian, of 60 to 80% falls in UK programs for clean water and sanitation around the world. And it doesn't just stop with this year. So this is the budgeted spending over the next few years. And you'll see that obviously we've got a huge spike this year, but those increases continue to happen. And we don't know what's going to happen with overseas aid. Hopefully it will be restored. But the tremendous health impacts that are going to be seen through climate change. The government has done this much trumped investment in the green economy, but you'll see from these figures that it just doesn't hold up to say that it's the UK's #1 foreign policy priority, because it's just not backed up by our spending commitments. So what are we going to do about it? Basically, like the parliamentary response has been incredibly disappointing. The Labour front bench supporting fully increases in military expenditure. So while it's positive to see them oppose the Trident increases, I think there really is down to us basically. So get involved with any of the GCOM supporting organisations, such as CND or CAT or 36 others around the UK, and just share the information. Really, contact your MP today. There's a tool there on our Take Action page. And I think generally, just every time you're told that there is no magic money tree, that there isn't money available for the things that we so desperately need in this country, you have to raise the elephant in the room, which is military expenditure. So if you have any ideas on how we take the campaign forward, on what you can do in your local area, then please do email me. I'm really keen to hear people's thoughts. So thanks very much. I'll now stop sharing.
Thanks, Matt. That was great. I mean, I love your infographics. They're really excellent. And I have a question from Nicola. Will Matt's slides be available afterwards, please?
Yes, absolutely.
So you'll send them to Sarah, who's our technical whiz, and then we can put them on our website. I guess, is that the best thing to do?
Yeah.
Okay, thank you very much. A lot of food for thought there, particularly in terms of what actions we can take. And I know that we've also got on the 30th of April, there's the Day of Action as part of the GCOM's days, isn't it? The Day of Action against bases and so on. Could you just tell us a little bit about that before we move to our final speaker?
Yeah, absolutely. So there is a global day of action which GCOMS has been involved in the calling of, and in the UK here we've got a demonstration outside the US spy base at Menwith Hill between 2 and 4 p.m. So anyone who is in the north, do come down and join us there.
Okay, thank you very much. So that's something people can do outside, of course. Lovely. So to our final speaker, Dr. John Puntis. John is co-chair of Keep Our NHS Public, which is a campaigning organisation. Many of us will know of it, not least because CND and Keep Our NHS Public have cooperated for many years, particularly with the NHS Not Trident messaging. So, John, it's great to have you with us this evening. Over to you.
Thank you very much, Kate. It's very nice to be here. And Matt's figures there were particularly striking and terrifying in many respects, and show that, you know, the money is available. It's just what political choices you want to make in terms of where you're prepared to put it. And of course, we would all make the argument that putting it into healthcare is in a much more appropriate use than putting it into warheads. I mean, this government has an awful lot to answer for. There's around 150,000 people now who have died in the UK from COVID. This is incredible for you know, one of the richest countries in the world. And it means that we're one of the worst countries in terms of outcome. And we must not forget this, you know, we must not forget this. The government using every opportunity to say, isn't the vaccination program wonderful? Haven't we done well? Hoping that people will forget the fact that they have literally piled the bodies up. Now, I don't know whether the Prime Minister really said that or not. I can guess, but the fact is that was the plan. You know, the plan originally was herd immunity. That potentially was something like 600,000 people dying before we had herd immunity. So it wouldn't be surprising me at all if that had been said. And one of the things that we really do need is an urgent inquiry into the whole mismanagement. And this is not an academic exercise. It's not academic because even government scientific advisors are predicting that there will be a third wave. They're just not sure how big it will be, but some modelers are saying it could be as bad as the second wave. So very considerable number of additional deaths if things continued to be done badly. And there's no real sign that the government have learned from their mistakes, or even that they're very willing to examine them. And the Bereaved Families Support Group, as you all know, or many of you will know, asked the Prime Minister back in June last year if he would hold a public inquiry. And he said, yes, of course we will, but now it isn't the best time and we'll do a bit later on. And they kept pressing him. And finally, he said to them, look, we're not going to have an inquiry. We're far too busy. We're so busy trying to protect you all from COVID and vaccinate you that we just don't have time for frivolous things like inquiries. And of course, what they mean is that the political damage to the Conservative Party would be so great from any inquiry that they want to delay it for as long as possible. And this is one of the reasons why Keep Our NHS Public has been running our citizens inquiry, or people's COVID inquiry, as we call it. And if you haven't come across that, you can find it via our website or simply by searching People's COVID Inquiry. And it's had some very impressive witnesses, including people like Michael Marmot, Martin McKee, the doctor who is in charge of the New Zealand response to their pandemic, Michael Baker. Rachel Clark was on a couple of weeks ago. And there's still 4 more sessions to run. And then finally, we will compile a report into our findings and our recommendations. It's being chaired by Michael Mansfield. All the sessions are recorded and available on YouTube, and it's well worth watching. Now, of course, one of the problems that our inquiry highlighted was the poor state of the NHS even before the pandemic hit it. And as Danielle said, there were huge staffing problems already, with something like 100,000 staff vacancies, 40,000 of them being nurses. And this was even before the additional burden of a pandemic. And this was partly underinvestment, but it was partly austerity, which dictated that the NHS, instead of having its usual 4% uplift each year, should have it reduced to 1%. That 4% just about allowed the NHS to keep on top of growing demand, but 1% certainly hasn't been enough. And that meant there has been a pay freeze, because pay is about 70% of NHS expenditure. And so one of the things the government like to say is, well, of course, the nurses have had good pay rises. What are they complaining about? But in fact, their spending power has reduced steadily since 2010, probably on average by about 15%, although of course very variable depending on your precise grade and job. But a 15% rise, which may sound generous, actually just takes people back to the spending power that they had in 2010. So it's not over generous. And 1% rise offered by the government is actually a real insult, not least because under Theresa May's settlement for the NHS a couple of years ago on the 70th anniversary, it included budgeting for a 2% rise this year. So that money was available and budgeted for. So effectively, the pay rise which had been agreed has been halved, and workers are being told that's generous, that's all the country can afford. And I think this is a nonsense. We now have a situation, of course, where there's been something like 50,000 staff off sick. There's going to be many who are struggling with psychological and mental health problems because of what they've been through. There's going to be many who are struggling with long COVID, which is becoming really an enormous issue for the NHS. And we're having surveys showing that something like 30% of nurses and midwives are seriously considering leaving the profession. So not only is recruitment going to be difficult, but retention is going to become increasingly difficult, just at a time when we actually need more investment and more staff. Meanwhile, the government can find money for lots of other things. Obviously, the topic of this meeting is defence spending, but from a health point of view, during the pandemic, we've seen this extraordinary handing out of contracts to supporters and donors of the Conservative Party. This is called cronyism. It should just simply be called corruption, because that's what it is. And Lord Bethell, who was one of the people who said nurses were very lucky to have a job and should stop campaigning, one of his unpaid advisors actually lobbied for health companies that got government contracts. One of them was a company called Bunzl Healthcare, who got a contract for PPE, personal protective equipment, for 22.6 million without it going out to tender. And this is one of the contracts that the government didn't disclose, that they were taken to court over by the Good Law Project, and the court found that they had acted illegally in not releasing these contracts for public scrutiny. And probably the worst example has been the test and trace program, which quite wrongly is called, and misleading, deliberately misleading, is called the NHS test and trace, where it's actually privatized, 37 billion, and it just doesn't work. So the Parliamentary Accounts Committee looked at it recently and said, actually, there's no evidence that this is reduced infection at all. That's 37 billion that could have been much better spent on local public health teams who would have done a much better job. And that's something which still needs to happen. That's an urgent priority now, as I said, given the third wave. So there's plenty of money for cronies, there's plenty for party donors, and there's plenty for the military complex, as always. So just to finalize things, I think that sometimes huge crises like pandemics can actually be a catalyst for social change. And Arundhati Roy, commenting on COVID, said it's a portal, it's a gateway between one world and the next. The question is, what is the next world going to look like? And we know what we would like it to look like. And it's one of greater international cooperation. If anything you learn from a pandemic, one of the things should be that we're not isolated national communities. We're part of an international community, and we actually have to cooperate together for our future survival. So we need to go into that kind of world where defense is not about spending money on nuclear weapons. It's actually about promoting a really good health service, public health service. This means looking after and valuing your staff, which means paying them properly, making these kinds of decisions which are going to benefit people and make their lives much better. And this is something we really have to demand. And this is an opportunity. It's an opportunity the government don't want to take, but it's an opportunity for citizens to say, this is a gateway into a new world. We don't want things going back to how they were. We want something completely different, where we care for each other and we look after each other, and we choose what are the spending priorities. In terms of support for the nurses and other health and care staff, Keep Our NHS Public health campaigns together and NHS Staff Say No are organising events on the 3rd of July. This has not been widely publicised as yet. Obviously, I'd encourage March as well, but on the 3rd of July, there'll be lots of coordinated local demonstrations, often outside local hospitals. You can find out about these by going on to the Health Campaigns Together or Keep Our NHS Public websites. There's nothing up there at the moment, but there will be in due course. And this is an opportunity for the public to go and show their support, not only for the NHS, but also for the staff and for their pay claim. So that's the 3rd of July, 2 days before the 72nd birthday of the NHS. Thank you very much.
Thanks very much indeed, John.
Thanks very much indeed.
I'm getting some feedback now. I don't know why that is. Okay, so very important things there. We've got some links. I put a link to the People's COVID inquiry in the chat line. John's mentioned the 3rd of July. There will be demonstrations at hospitals and so on. So keep a lookout for that either on the Health Campaigns Together website or on the Keep Our NHS Public website in due course. So thanks very much indeed. So, okay, everybody, audience, put your questions in the chat and the Q&A box. I've had a few in. Some of them are very specifically health orientated. Some are more war and weapons orientated. So I'm going to just go straight in with two that are specifically health related, but very political. So, and then I'll pose those to John and Danielle if you want to come in on either of those, and then I'll go on to the more weapons orientated. So first of all, I've got a question, and I can see where this is coming from. Is a zero COVID strategy possible? Because we keep on being told, oh, we've just got to learn to live with it. But zero COVID seems like an effective strategy, potentially. Is that possible? So that's one for our health professionals. And then secondly, this touches on something, John, that you were talking about privatisation and so on. Is the underfunding of the NHS intended to drive a turn to private medicine? So a couple of questions there. Danielle, I don't know if you're, because you can't see, it's a bit disconcerting.
I'm here. About zero COVID, I mean, I'm not going to pretend that I'm an expert or an economist or anything, but I can just say, like, in New Zealand, that's an island, and they've managed to make it a success, and we too are an island. So I don't personally see any reason why it couldn't. Well, it could work, but I can see a reason why it wouldn't. It isn't going to work. It's because of the government, because that's the approach that they don't want. But I would say, based on New Zealand, that it could work, but I'm not an expert. And the privatisation question, yeah, definitely, that's entirely what I certainly believe that the government are up to.
Mm. Thanks, Danielle. John, over to you on those.
Yeah, so zero COVID doesn't mean eradicating COVID, because I don't think we'll never ever do that. It's about an approach which means there's zero tolerance of spread of COVID in the community. So that means, first of all, border control, an effective testing and tracing system. And then one of the things that we haven't had, a support system, so that people can actually isolate. So only 20% of people asked to isolate in the UK, or who should be self-isolating, do so. And a lot of that's down to economic reasons. They can't afford to isolate, or they're living in housing that's already crowded and they can't actually isolate in their houses. So zero COVID is entirely possible in that sense. Zero tolerance towards spread of COVID. It means following the example of not only New Zealand, but Vietnam, South Korea, a number of countries, China you could include here as well, where their policies have been extremely effective. And it's not too late. It's not too late to do it, actually. So I think it's still a perfectly valid option that we should be saying to the government. It's essential for a complete change of course, and that we shouldn't be just saying we'll live with COVID. We should still be saying that we will try and suppress it completely and effectively, and we're just not doing that, and it's never been part of the government strategy.
Why not, John? Why do you think the government hasn't gone with that when it can be done effectively?
Well, I think it's partly because of the completely incorrect argument that there's a trade-off between the economy and lockdown, for example. The countries like New Zealand that locked down early and hard, their economies have done much better because they managed to contain the infection and then end lockdown. But in the Conservative Party, particularly, there have been the people who've never wanted lockdowns, or who've argued that they're prematurely ended on the grounds that it's harming the economy. And that's completely wrong. And of course, part of the economy is having a healthy population, and you can't disregard the health of the population and have a strong economy. But I think that's why they did it. And right at the beginning, their strategy said, interestingly, the only way out of this is either with an effective treatment, an antiviral treatment, or with an effective vaccine. So they never put basic public health, long established, tried and tested public health interventions, such as the contact tracing and the support for isolation. They never put that at the heart of their policy. And again, part of that problem was that on the SAGE group that advises them, they didn't have many people who were expert in public health. So they weren't really even consulting with the right people.
Okay.
Privatization, yes, I mean, unfortunately, one of the ways that you get the public used to the idea of your public services disappearing is to defund them. We've seen with COVID, there's been this huge increase in the handing out of very lucrative contracts to companies like Serco. And the current white paper on the NHS is actually going to make it even easier for privatized companies to make inroads in the NHS, and even have representatives of private companies sitting on the integrated commissioning boards, which are deciding which services as members of the public we should have access to. So the privatization element is being driven forward and accelerated by COVID.
Okay, thank you. Now I'm going to turn to a couple of questions that I've got in around the kind of more warfare side of this. And Matt, I'm going to come to you first on this, and of course turn to our other speakers after if they want to come in on this. So a kind of broader question first. Why is warfare prioritised over healthcare? So that's a bit of a philosophical poser for you. So have a go at that, Matt. And then the second one around the health impact of nuclear weapons. And obviously that's something which drove the Treaty on the Prohibition of Nuclear Weapons, Red Cross support and so on. Well, actually, that's something for our healthcare professionals too. You know, is it possible to actually, you know, come back from the health impacts of a nuclear weapon? So, Matt, over to you first.
Right. Well, that's not a tricky. That's a tricky one to start with. But I mean, I think the only answer really is that there are significant lobbying elements that we are pushing against. Which I think touches on the stuff which John has talked about today on the privatization of healthcare. And really, they prioritize warfare, I think, due to posturing, and because we let them get away with it at the moment. So, so I think, as John said, the pandemic does offer an opportunity, really. I think it has made people reassess what's important. And I think we do have a great opportunity now to really push this and bolster each other's campaigns. So, as you mentioned, Kate, the success of the UN ban treaty came because you had lots of the sort of not the usual suspects, really. So you had the Red Cross and these sorts of organizations coming out against nuclear weapons, and I think that's something that we can do here. Really, we can be amplifying healthcare workers and aid workers, and you know, and demanding a green economy, and it's only by that sort of holistic approach, really, to how we want to see our economy and our society structured. I think that's where our greatest potential to make change lies.
You mentioned there the green economy, Matt, and I notice in the chat line we have comment, I think it's from Linda. She says, we need to go through that portal into a Green New Deal that would bring together cutting carbon, creating good jobs, protecting the NHS, lots of jobs in care, climate justice for the global south, which would obviously include no nukes and massively decreased military spending. Well, yeah, I think, Linda, no, you hit the nail on the head there. That's like our vision that we all want. Very nicely summed up in one sentence. So good, thank you very much. Okay, Matt, I don't know if you want to have say anything about the health impacts of the bomb, if you want to leave that to our health colleagues, or do you want to say anything about that?
Yeah, I mean, I think I'll pass that over to those who know much more about it than me. I mean, we are just on the, we've just commemorated the anniversary of Chernobyl, of course, which I think is something which is very much in all of our minds just at the moment. And I think, you know, we should, again, try and draw these parallels and make these links wherever we can, but I will pass over to our health colleagues.
Okay, well, thanks very much, Matt. Just looking in the chat again, Sarah has said, could we have a mass programme to encourage people to book to see their MPs, including Tories, and ask about nukes and nurses and explain about the funding? So yes, we actively encourage everybody to try and book an online session with their MPs. You know, if you can't go in there to the surgery, book an online session with them and tell them like it is and what you think about it and what you want our money spent on. So great idea, Sarah. You're just the person to get in touch with your MP and do that. But I would recommend that for everybody. So I'm going to turn back to our health colleagues, but I'm going to add in 2 questions that have come in the Q&A box. Barbara says, Danielle, could you tell us an average nurse's salary, please? I was shocked to hear that 1% is £6 per week. So you don't have to answer that, Danielle, if you don't want to, but feel free. And then,
sorry, carry on.
Oh, just one more. Claire has said, was the £3 billion promised to the NHS for a recovery package a true extra funding or part of accountancy fudgery? Is fudgery a word? It's a good one. Danielle, over to you.
That's a good question. The average nurse's salary, I think it's around 30. I'm just looking it up on my phone. The starting salary of a nurse is about £24,000 a year, and the majority of nurses, we work in a banding system, so the majority of nurses stay in band 5, which goes up to about 30,000, and you work your way up through that over the years. And the average pay of a nurse, I think, is about 30,000. I think that's the average, and it's hardly gone up. You know, it's hardly gone up at all over the last 10 years.
Okay, thanks, Danielle. Do you want to comment on any of the other things at this point?
I'll probably pass to John for that one.
Okay, John, do you want to come in now?
Well, could health services, I think the question was, could health services function in some way in the event of a nuclear strike? The answer is no. I mean, they've nearly been overwhelmed by COVID. You could argue they have been overwhelmed by COVID. I mean, I think I can't imagine there's anyone on this call who hasn't seen The War Game, but if you haven't, it was reissued by the British Film Institute about 10 years ago. You know, it's just as striking as when it was made, I think in 1968, shows the impact of a nuclear strike on the UK and the effect it would have on society. There will not be a functioning health service. No question about that. The other issue about funding, I mean, it comes back to what I said about the annual uplift for the NHS. Ever since 1948, the NHS has got a little bit more each year, give or take. That's generally on average 4%. In 2010, that stopped, and it was 1%, which allowed the government to say, look, we're still giving the NHS more money than it's ever had. But the fact is that the population goes up, the demands go up, the treatments available go up, the things you can treat, change. There's a huge hole in NHS finances. So it would need about 35 billion now to make up that hole. On top of that, you've now got 4.9 million people on the waiting list. There's incredible backlog of delayed treatment and delayed investigation, and huge holes in your numbers of staff, and indeed your ability, given the kind of social distancing required in hospitals for the foreseeable future, reduced capacity. Just in terms of the capital deficit for building repairs and replacing worn out equipment, that's now 9 billion, because all the money for doing those things has been diverted over the last 10 or 12 years into keeping frontline services going. So what the government gave to the NHS was peanuts. It certainly doesn't meet the obligation or the commitment given by Rishi Sunak that the NHS would be given everything it needed. It's very far short, and this has to be recognised. There needs to be major investment in the NHS. And the biggest privatisation contract in the offing at the moment is 10 billion that's going to go to the private hospital sector to do NHS work. And that's crazy, but it's part again of blurring the distinction between a public service and privatized medicine in the way that Matt Hancock likes to do. For example, saying the vaccination has been delivered by the private sector because GPs are private and the companies who make the vaccines are private. Isn't this a triumph for the private sector? And the answer is, look at every other aspect of the pandemic that's been handled by the proper private sector, and it's been a disaster.
Okay, so we haven't got so much time left. So just going to look at some of the questions here. Yes, Timothy has asked, will a recording be available on C&D's website of this event? And the reply from Sarah, yes, it will be available on the website and social media channels also. So that'll be there tomorrow morning. So please do share those, spread them around and so on, because it's been a really fantastic discussion. Moira, who I know lives in the East Midlands, she's pointed out defence diversification. Ventilators and hospital equipment should be built instead of nuclear propulsion elements at Rolls-Royce. They make the nuclear propulsion reactor things there for the submarines at Rolls-Royce in Derby. So, that is something that we as C&D very much picked up on, how people who had been making weapons and making parts of the nuclear weapons system were turned over to making healthcare things. No doubt they've gone back now to making weapons of mass destruction, but it showed what can be done. So there are very important lessons there as well. So I've got just a few comments I'm going to read out from the Q&A box, and then I'm going to give each of our speakers 2 or 3 minutes to conclude, to make your final remarks. If you want to touch on any of these things, you can. But please do share your thoughts with us about next steps. If you want to ask us to do anything, if you want, getting your message out there in any ways we can help, please do use this as a platform to get your message over. So the final points I'm going to raise there, Keith says, how does our defence and health spending compare with other countries in Europe? I'm sure Matt will be able to reply to that, at least in part. Pat Sanchez talks about how NATO obliges us to spend, I think it's 2% of GDP on the military. She says, would there be any mileage in a campaign to equal NATO and health/social care spending commitments? It might wake people up to how much our membership of NATO costs us. So that's an Interesting campaigning thought. Thanks, Pat. And then Michael says, what happened to the 350 million a week we were promised on the bus? I mean, it's the sides of the Brexit campaign bus, I think. He says, has this been spent on carpets and curtains? Good question. Okay, and then Roger is talking about, in fact, we haven't signed up to the TPNW, you know, and how we need to move that forward. So thanks to everyone for their contributions. So now I'm going to turn to our speakers, and if you just briefly in a couple of minutes, anything final you wish to say to conclude. John, would you like to go first on that?
Well, yes, thank you very much. As the topic was to do with pay, I would just there's one point I would make, as that is that managers know very well, if you look after your staff and you care for them and make them feel valued, they work better and you get better patient care and better outcomes. There's absolutely no excuse for underpaying staff, and the fiscal multiplier for spending on health is you put £1 in, you get £4 out, so it stimulates the economy. There's a strong economic argument. And then I would also say that this pandemic, it's not just been a health crisis, it's been a political crisis. It's shown us these huge inequalities, and actually it's exacerbated them. And I think that that comment by Arundhati Roy about the pandemic being a portal, a gateway into a different world is really something we should keep hold of, because we're an international, if there's an international response which is based on trust and cooperation, and this is the philosophy that we need for the new world that we want to come out of this terrible disaster. Thank you.
Thanks very much indeed, John. That's brilliant. Matt, over to you.
Yeah, I mean, just to say in conclusion that we're still in the middle of what's called the Global Days of Action on Military Spending, which goes on till the 17th of May. And I think what's been inspiring for me about that is to see so many different organizations that represent so many different sectors and fields of interest, but who all agree on the same thing, to really who've really engaged in it this year. And I think it's an opportunity, as all the panelists have raised, to really emphasize that there is a magic money tree, that we see it annually when the defence budgets are drawn up, and that it's not these are not the priorities that we need at any time, but especially during a time of pandemic and of a climate crisis. So yeah, so just keep spreading the word, really. We have a budget for whatever you need.
Thanks very much indeed, Matt. Danielle, over to you for the final words.
I'd just like to say, well, first of all, thank you for having me, and thank you for listening. As I said before, like, our morale is so low, and if we think about we might have another wave of COVID, I don't actually know how we're going to do it. And the government, they really need to do something to show us that we're valued, to keep us going through that, because I really don't know how we will do that if they don't. And what is just really struck me is one of the questions was about spending on defence and health in Europe. So I actually looked it up, and we spend the most in Europe on defence, but the least on health. So the government just really prioritise defence over health, and then you hear things like my colleagues going to food banks. It's just they've got their priorities all wrong. So I would ask that you please support our Fair Pay for Nursing campaign. And in the chat box, I put a link for the RCN Fair Pay for Nursing. And as I said, there's so much different stuff that you can do on there and sign up to. And over the coming months, there will be more events and things that are going on as we move through the pay campaign. And to correct myself, the demonstration for the People's Assembly is on the 26th of June with the Nurses Not Nukes contingent. So go and join that. And yeah, thank you for having me.
Thanks so much, Danielle. And we just send all our love and solidarity to you and to all your colleagues, you know, and we'll do what we can. I know everyone on this call is going to click on that link and support your campaign. So
thank you.
Thank you so much for joining us this evening. There have been some comments in the chat line about Nurses Not Nukes t-shirts. Now, we had the very, very popular NHS Not Trident ones, but in solidarity, we have a new line coming in, Nurses Not Nukes. We're hoping they're going to be out in many hundreds, if not thousands, on the Nurses Not Nukes block on the 26th of June. So I hope everyone will join us there. So a big thank you to our speakers, to Danielle, to John, to Matt. It's been a fantastic discussion. Thanks very much to you all for joining us this evening. When we close imminently, you will, if you stay on the call, you'll see some examples of stuff from the CND shop. If you're looking for t-shirts or badges or anything like that, do stay on and see that. But thank you all so much for coming. Again, Danielle, John and Matt, brilliant evening. Thanks very much. Solidarity.
Oh, Claire. Hi, it's John.